Okay, my audience. Okay. Did you know there are enough people in the United States waiting for an organ donation to populate an entire city? That fathers, mothers, even children are facing the reality of never receiving an organ before it's too late? Unfortunately, thousands never receive the call saying that a suitable organ donor has been found. In fact, almost 7,000 people in the United States alone will die this year waiting for transplantation. And these numbers will continue to rise unless we make a serious effort to reverse this trend today. I trust after hearing my speech, you'll recognize the significance of organ donation and the many reasons we should all become donors, along with deciphering the facts from the fiction about this topic. Also, how you can make a difference by becoming an organ donor, identify the management of the distribution of organs, and understand the process recipients must experience before receiving a donor organ. First, we'll discuss the importance of organ donation and why you should become a donor. According to the National Network of Organ Donors, 19 people die every day in the United States waiting for an organ transplant. And currently, there are more than 111,000 people on the transplant waiting list. And the number of people dying from waiting for transplants will continue to grow, from 10 people each day in 1990 to 14 a day in 1996 to 19 today. According to the United States Department of Health and Human Services, a person in the United States is listed for transplant every 11 minutes. That's 130 people joining the list every day. On average, 75 people receive organ transplants every day. However, because of the shortage of available donor organs, 19 people die each day waiting for transplants. You may save up to 8 lives through organ donation and enhance as many as 50 others through tissue donation. Last year alone, donors made more than 28,000 transplants possible. According to the Mayo Clinic, another 1 million people received cornea and other tissue transplants that help them recover from trauma, bone damage, spinal injuries, burns, hearing impairment, and vision loss. Now we'll focus on some of the common myths surrounding organ donation and transplantation, along with the actual facts. Despite continuing efforts of public education, misconceptions and inaccuracies about donation persist. Many people think that if they agree to donate their organs, the hospital staff won't work as hard to save their lives. When you go to the hospital for treatment, doctors focus on saving your life, not somebody else's. You'll be seen by a doctor whose specialty most closely matches your particular emergency. And the doctor in charge has nothing to do with transplantation. Donation can only be considered after you are deceased. Some people think that organ donation may be against their religion. Organ donation is consistent with the beliefs of most religions. In fact, all major religions in the United States support organ, eye, and tissue donation and see it as a final act of love and generosity toward others. If you are unsure of your faith's position on donation, ask a member of your clergy. People may think that an open casket funeral isn't an option for a person who has donated their organs or tissues. Organ and tissue donation doesn't interfere with having an open casket funeral. The body is clothed for burial, so there are no visible signs of organ or tissue donation. Through the entire donation process, the body is treated with care, respect, and dignity. Others may think that nobody would want their organs due to their age or their health history. There is no defined cutoff age for donating your organs. Anyone can be a potential donor, regardless of age, race, or medical history. Decision to use your organs is based on strict medical criteria, not your age. And it may turn out that certain organs are not suitable for transplantation, but other organs or tissues may be just fine. However, there are people with certain medical conditions that cannot donate their organs, and that includes people with HIV, active cancer, or systemic infection. Don't ever rule yourself out. Only medical professionals at the time of your death can determine whether your organs are suitable for transplantation. Finally, Finally, we'll discuss how you can become an organ donor, the management of the distribution of organs, and the process involved in receiving a donor for transplantation. The most important thing you can do is to sign up as an organ and tissue donor in your state's donor registry. Most states do have these registries, and you can check the list at organdonor.gov and designate your decision on your driver's license. You can do this when you obtain or renew your license. Sign and carry a donor card. Cards are available again from organdonor.gov. Tell your family and friends about your decision. Even if you sign a donor card or the back of your driver's license, if your family doesn't give their approval, the hospital will not procure your organs. So why do hospitals need this consent if you've already signed an organ donor card or the back of your driver's license? Because they fear a lawsuit if they go against the wishes of a patient's family, especially if the family is strongly opposed to organ donation. Inform your faith, leader, physician, and friends. Include donation in your advance directives, will, and living will. The National Network of Organ Donors believes that signing a legal document should guarantee, without exception, that your wishes are met. By following all these steps, you will be ensuring that your request to be an organ donor is known and honored. Who manages the distribution of organs? The United Network for Organ Sharing maintains the Organ Procurement and Transplantation Network. Through their computer system, organ donors are matched to waiting recipients 24 hours a day, 365 days a year. What is the process for receiving an organ for transplantation? If you are in need of an organ transplant, your doctor will help you get on the national waiting list. Your name will become a part of a pool of names. When a donor becomes available, all the patients in the pool are compared to the donor. Many factors are considered in the decision of who receives the organ, including blood and tissue type, the size of the organ, medical urgency of the patient's illness, their time already spent on the waiting list, and distance between donor and recipient. First, the organ is offered to the candidate who is the best match. The organ is distributed locally first, and then if no match is found, the organ is offered regionally, and then nationally until a recipient is found. The hardest part of the process is waiting. There is no way to know how long you will wait to receive a donor organ. As you can see, organ donation and transplantation offers so many a second chance at life. By donating your organs after you die, you may save or improve as many as 50 lives. Signing up to be an organ donor is one of the most generous acts you can do by preventing any more needless deaths. Sadly, thousands die every year waiting for an organ that never comes. However, we have the power to change that. We have the power to make these miracles happen. It's truly the greatest gift we can give each other, the gift of life. Currently, there are more than 100 million people in the United States who are signed up to be an organ donor. So what are you waiting for? Sign up and join them today and provide hope to the thousands of men, women, and children who are awaiting organ transplants, and for the millions of people whose lives could be enhanced through tissue transplants. Together, we can save lives.